or maybe the video afterwards. Today you're going to be hearing about caregiving for your parents from a distance. And my name is Dorothy Griffin. I have the pleasure of working with an amazing team of professionals that put on these programs once a month to just help educate and provide support for those who are maybe on the caregiving journey or working towards that, maybe just getting some extra education about the aging process. If you're not familiar with ACAP, ACAP Community is a nonprofit that was started in the Hickory, North Carolina area by a caregiver and an educational professional. And so she was interested in bringing her educational background to help prepare people for this journey and also help connect them to each other. So the mission is to provide information, resources, support, and community through monthly programs, podcasts, and other resources. We started our chapter here of ACAP Cape Fear over a year ago, and there are now chapters in Georgia, New Jersey, and Pennsylvania, as well as North Carolina. So it is nationwide. You're going to hear from our sponsor. They're part of what makes these programs possible and free for our attendees. And then our presenter is going to share her wisdom with us for most of the time. Our question and answer session will be at the end, but please feel free to ask questions along the way. This is interactive. If you have a question and you're streaming, please just type that in, I think in either the chat or the comments, and we'll be sure to ask those questions as well. And then if you need the restroom, I think they're out and then a little bit to the left. So if you need that during the program, please help yourself. And there's also some refreshments. We try to wrap things up by around 7:30 p.m., but sometimes we do get done before that. So we're going to start with our sponsor. Since we are a nonprofit, we have sponsors that help to put on these programs. And Jesse Bissett is with Wilmington Funeral and Cremation. So he's just going to share a few words about how he can be a support for you on this caregiving journey.
Thank you, ma'am. Hey, everybody. I'm Jesse. I'm with Wilmington Funeral, and it is an honor to be here. I have a little bit different job in the funeral profession. I am a pre-planning director. So I'm the person you see years or decades before you need to see the other guy. And as that relates to what we're doing here with the caregiving from a distance, thanks to modern technology, we do have a lot of families who have aging parents here in town and their adult children are elsewhere, New York, New Jersey, Chicago. We are able to make these arrangements 100% remotely. And I can also do Medicaid spend downs. That's my daughter running around the background in case you're wondering why this says dad. Child care at 6 p.m. is an issue, but here we are. Hi, T. Thanks for joining. This is Taylor. This is Taylor. But I specialize in Medicaid spend downs, but my real job is not about funerals, cremations, death certificates, any of that. My real job is to remove the emotional, financial, and legal burdens from the next of kin. And that's what I do all day, every day. So with that, thank you for allowing us to be here.
All right. Thank you, Jesse. I have the pleasure of introducing our speaker tonight, Dr. Jennifer Sherman. She is a Chief Compliance Officer at Brunswick Senior Resources, Inc. at Charlotte, North Carolina. And she's been there 20 years in January. Is that what you said? It'll be 20 years in January. So very dedicated to aging education. And in addition to her compliance role, she's also the director of the Aging Resources Division. So she helps to foster independence among older adults through various programs and services, including the North Carolina Home and Community Care Block Grant. Her expertise extends to crisis counseling, substance abuse counseling, and human resources. And she has her doctoral degree in theology and human resources and a master's degree in human services, counseling, and executive leadership. So please join me in giving Dr. Sherman a warm welcome.
Hey, everybody. So I have not actually done presentations in a while, probably since COVID. I was one of the ones that got the first round of COVID who had to be hospitalized and almost didn't pull out of it. So I was oxygen dependent for quite a bit and really got to learn the value that I was sharing with Jen of AIDS coming out of that experience and how important that they are for those of us that are aging and also for caregivers. My bio makes me sound really good, but I am not a public speaker. So, of course, I made myself notes to make for sure I stayed on track. And I will definitely share those with y'all so you can follow along. But I'm a caregiver myself, and I think that that is probably one of the most important roles. When I first moved back to Brunswick County, it was because my father was sick. I tried to be along distance caregiver. And back then I was not very successful at it. I was still in school. In fact, I ended up having to change my degrees several times because of the caregiver role. My father had us at a young age, and I was 26 when he was diagnosed with terminal cancer, which ended up the treatments for that. He developed having dementia and Alzheimer's. So he lived with me for 11 years. And no matter what type of schooling that I had when I moved back home to care for him, that I had that, and I was working for Brunswick Senior Resources, being the caregiver, I think prepared me for the best training for what I do. So with that being said, I also I know that this is strategies and engaging in ensuring safety, but some of the cool things that we have found along the ways for those that are caring for folks with dementia or Alzheimer's are some of these pets. And so I'm going to turn them on so y'all can see. Has anyone ever used any of these before? And if they get on your nerves, you can turn them off. But I've got, in fact, my Vanna, she's going to help me let y'all just rotate them at the table during the presentation. And I have a drawing at the end. If you make sure you filled out, and here's even a comb for the cat. If I get really bored, if you get really bored with me, you can start just grooming the animals for me, and I'd appreciate it. And here's the dog version. But I would love to know. And then we're also going to do a drawing for the Live Inside memory player. Have any of y'all ever seen these before? How many of you are caring for someone with some type of dementia? Anyone? No? Yeah, so that's definitely a blessing. But maybe you can share this with someone that you know that does have someone. But Alive Inside has this awesome documentary about the power of music. And even if you're not caring for someone with dementia, there's so much joy and connection that you can find through sharing music with one another. And you can download, hundreds of songs on this player. And then you can even plug in and listen with your loved one, even at home. Or they could just use this if they're sitting at their chair, and it's so comfortable. So I've actually got this. This one is the one for you just to try out, but we're actually going to raffle 2 of those. If you want to pass, there's just generic music on that one for right now. And they'll actually kind of get a little scary. All of a sudden you'll forget that the animals are there, and then the cat will start pawing at you. Or let's see it twitching his ears. So it's going to be amazing to see how technology with AI will transform things with even just these type of devices that they have. So as she's already introduced me, so we all are facing challenges with our extended families and what it has brought in the medical and healthcare world with enabling people to live longer. Yes. Back up. Okay.
We can't see your face.
Oh. I don't see the little screen. So okay. Hey. What we're going to do today, all of us that are we're just spread out across the world basically, and we're caring for loved ones. Vanna might have to turn that kitty off. That kitty's very vocal. We're all caring for loved ones across the world, and sometimes that can be challenging. Back then, and we're talking about 25 years ago for me, I couldn't do it, and that's how I ended up moving back home. And that was never the plan for me. I was a preacher's kid who ran to Vegas for school, right? I had planned on staying in Vegas, but it looked different for me. And so what I'm sharing with you are some of the things that I have found along the way that help our caregivers be able to care for their loved ones at a distance. So our goal today is to learn how to compile and manage parental records before an emergency occurs, recognize the signs of depression, neglect, and or abuse, put in place strategies for making home visits and long-distance contacts more productive, research and manage technology and other resources to enhance parent safety and engagement in their home and community, and evaluate the need for new or changes in the home, residential care, community support services, and then extra time for Q&A and see who won these awesome prizes. And then that will be our presentation. So what I did was print my notes out because I'm going to reference some websites. Thank you. You did not know you were also going to help Vanna, right? So a lot of the links that I mentioned, you'll have access to those. This is actually my entire presentation, so you're more than welcome to have that. But when you're compiling and managing parental records, there are a lot of templates, organizers, notebooks. One thing about AARP, they are always providing information for us. And I love their planning guide that is actually online. You think you know until you go through AARP's planning guide. And then you're like, I have no idea. Where has this been my entire life? Because there's things that you forget about until you go through it. And you're like, oh, yes, how did I forget that? And then there's other ones online that are really nice and cute that you can purchase. And then there's some that you can just download the templates. But there's a lot of support at your fingertips that can help with the caregiver notebook. The National Institute on Aging, the NIA, they have personal health record toolkits. That address, that link is www.nia.nih.gov. You can also, they have toolkits available, but whichever toolkit that you're using, make for sure that you have a shared digital platform that you can keep, like Google Drive is one that I use to make for sure that you keep everything organized and accessible even by your phone. Or even if you have a contact at home, wherever your parent is living, or a neighbor or someone that can help upload that information for you, or they could take a picture and then you can make for sure that you put it in your digital platform. There's also dedicated healthcare apps for that. So you can look in, sometimes even on your phone, you can go to the App Store and just search digital storage platforms, and it will show up with all kinds of new ones. And that's how I learn a lot with technology. I'm constantly Googling and looking for new products. Patient portals. Y'all, I have never been so happy until Novant here merged their new Hanover group to the Brunswick group, because y'all know I live in Brunswick County. And I'm also now currently the caregiver of my mother-in-law and father-in-law and my mother. She actually moved here to take care of me when I got sick, and then she got sick. So the roles reversed. My mother-in-law and father-in-law, I was the caregiver of my sister-in-law. She was very young. She started having problems about age 62. By the time we figured out what was wrong with her, we found out on her birthday, April 24th last year, and then she passed away June 6th. So patient portals are so important because I had access to her Novant accounts, but I did not have access to her Duke patient portal. The test that they found the lung cancer in the year prior, I did not know, and somehow it missed. She didn't find out about it. And by the time she went to the emergency room, the cancer had spread, and we didn't even know it had been found or located until we were sitting in front of the doctor. And he said, well, I see a scan here from Duke. And I was like, what? So like if your parents live in an area where there's different patient portals or they're in different systems, if there's a way you can consolidate that, or maybe try to get them in one system so you have access to all of their health records, it is beneficial for sure. I don't know what the outcome would have been if it had been different. It would have probably looked a little different for my sister-in-law, but I missed that other portal. There are applications out there. There are reminders for the users. So one of my biggest challenges was medication management. That was so hard living in Nevada and my father being in North Carolina on reminding him when to take his medicine. and if he took his medicine. So there are apps now that the user can use, and there's so many different ones, like Pillboxy. That seems to be some of the favorites. It's actually visually looks just like their pills. You can set it up that way, but it reminds them to take their medicine. But for us caregivers, Walgreens is one of my personal favorites. And the reason why is because it's so user-friendly for me. They can share their app with me. I can order their medications. I can request refills directly to the physician. And then if for some reason I can actually DoorDash it right through the same app. I can do Instacart. I can do their groceries and have the Instacart. Most Instacart providers will swing by Walgreens or CVS, but Walgreens seems to be right now my favorite app for a caregiver. It's just easier. So I'm trying to switch everybody to Walgreens, but that always don't work with the state health plan. Something new in our area that we use a lot for is the Amazon Pharmacy, which is the pill pack option. It's a blister pack. So when we're doing we're also advocates with the North Carolina Department of Insurance, where we assist folks in choosing their Medicare plans. So for caregivers, we choose the Amazon Pharmacy for them when we're doing comparisons as a backup, just in case. And we always recommend for everyone to do, if you're in the Medicare system, always do comparisons annually, and then make for sure that you know the benefits of the mail service pharmacy, or add in another benefit, add an Amazon Pharmacy on there, where if you need to do the blister packs, you can add that or switch their medicines to the Amazon Pharmacy. And how many people ever use the Senior Health Insurance Information Program to choose their Medicare Part D plans? Right? Yes. Yes. My husband just turned 65. He's new to Medicare as of May. And I've never been so excited to be. I was like, red, white, and blue, because, it saves us a lot of money for us, right? Employer plans. But that can be a little tricky, a little difficult to navigate, but there's help out there to help set that up for you. Your legal services and notary public, make for sure that you are looking at the financial planners and using them as well as legal services on how to manage or help manage someone else's money when you're living out of state, because that can be a little tricky sometimes. And there's a link right here. The Consumer Financial Protection Bureau's guide is very informative on helping you get things set up for managing someone else's finances using technology as a way of doing that. Oh, I'm forgetting to use my nice little control here. All right, so recognizing signs of depression, neglect, or abuse. And this is a tough one. So depression can manifest in several different ways. It could be sadness or a low mood for someone. For those of you that are caregivers, what is the main way that you're actually communicating with your loved one? Is it with like FaceTime or anything like that? Or is it just a conversation? Jody and
my dad and my brother and sister and I have an email chain going every week. Somebody starts it off and just keep emailing random weird things to each other just to make sure my dad's okay. And I call him once a week at least, talk to him, and my brother calls him once a week as well. My sister hates phone calls, so she will text him, and if he has his phone on, he does reply, but he lives in a very rural area, and so his cell service is not real good. Right. So if he's out and about running errands, he will send us a text message. So, yeah.
Yeah, I talk to my parents a couple of times a week, and then talk to my brother maybe every couple of weeks to sort of get his take on things, because he lives there with them, has his view of how they're doing.
I talk to my mom every day. She's in Louisville, Kentucky, but she does have my sister nearby. Well, she's now living with my mom as of about 2 months ago. So I know she's covered, but we talk well, I talked to her twice today. So I usually call her on my way in, on my way home. But I work in a senior retirement. So this morning I was on the phone at 7:30 with a daughter of one of my residents, trying to figure out some services to put in place for her today. So I kind of came for multi
reasons. Yes, yes. So when we're dealing, and it could be depression for any of us, right, or anyone that we're helping, even clients. But it could be a loss of interest or pleasure, changes in sleep patterns, changes in appetite or weight, fatigue, loss of energy, feelings of worthlessness or guilt, difficulty concentrating, agitation or restlessness, irritability, physical symptoms, headaches, digestive problems, chronic pain, social withdrawal, and just not wanting to go out anymore, not wanting to go anywhere anymore, and suicidal thoughts. So it's important to recognize, especially everyone who has constant contact with their loved one, to pay attention to these changes, especially if you don't live close by. And there's so many options right now through technology and telehealth since COVID. COVID had its negative impacts for us. But it also opened up a lot of doors to expand our telehealth options as well. So there's a lot of programs through COVID. Through our agency, we started offering free mental health services. I know New Hanover County has done the same thing. So I'm sure in most counties, they're actually doing that as well. So there's a lot of support there. So the next item here is neglect and abuse, which is where we get a lot of our calls from caregivers that live out of state for us to do just a ride by, or just, hey, check out this person, this landscaper that somehow has figured out a way to get in really close with mom, things like that. And North Carolina law protects older adults with disabilities of any age of abuse, neglect, and exploitation. So what's the difference? So abuse is willful infliction of physical pain, injury, or mental anguish, unreasonable confinement, or the willful deprivation by a caretaker of services necessary to maintain mental and physical health. Neglect, a disabled adult who is either living alone and not able to provide for themselves the services necessary to maintain their mental or physical health, or who is not receiving services from his caretaker. And then exploitation, illegal or improper use of a disabled adult or his resources for another profit or advantage. One thing that I learned, excuse me just a second, I'll make sure you get a copy. Did you get a copy? Okay. With working close with Adult Protective Services, because of my role with the Department of Insurance and the Senior Health Insurance Information Plan, when I think of a disabled adult, I think of Social Security, someone who's been approved for their disability, but that's not the case with Adult Protective Services. If someone identifies as being disabled or have struggles with their ADLs, which is activities of daily living, and they identified as being disabled of some sort, under that law, they're covered as a disabled adult. So when you're doing your referral or you're making any referrals and they ask you, are they disabled? If they struggle at any capacity, then yes, you can, when you call in, you can say, yes, they're a disabled adult. Because in the very beginning of my early years, I would mess up when I would do my referrals because I was thinking, well, they don't have Social Security yet. And that's not the case. So where do you report mistreatment? Well, let me go back to self-neglect, because that's something that can be a struggle for caregivers. In North Carolina, we have the right to make decisions as long as we have the cognitive ability to make decisions, even if they don't look like the decisions that we would make. And as long as there's not a cognitive impairment, our hands are pretty tied until you were to get them to a physician, have a mini-mental, something to determine that they're not cognitively able to make decisions. So if you ever notice signs of dementia or anything like that, or you're noticing a decline and you think at any time that they're not at the right place to make decisions, definitely reach out to their physician. All right, so where do you report mistreatment? So you would definitely call your social services, adult protective services. You can also call the North Carolina Department of Health and Human Services, their care line, which is 1-800-662-7030. And you can also call law enforcement if you have any suspicions. Financial exploitation. So with technology, that's definitely a problem right now with scammers. So anytime you think anybody is scamming or you see a scam, 877-5-NO-SCAM, call and report it to the North Carolina Department of Justice. And that number is in there as well. So I always like to add that disclosure in there because, you know, we have people preying on those that we love in the system, and technology has also opened that up to that. So making home visits and long distance contact, keeping them productive. So one of the tips with using technology, whichever way it is that you reach out to your loved one, keep an effective communication and leveraging technology to assist with that. So establish a regular schedule. So set up regular times that you're calling just so they also have something to look forward to. Active listening, validating their feelings, showing empathy. My dad loved talking about the fire department. And when I had school and papers and work, and sometimes I just did not want to hear what was going on at the fire department or what his neighbor had done. And looking back, I should have just been in it. I should have been like, what did he do, Daddy? What? Or you put him on the phone. You know, I wish I would have known to just engage and be present and to active listen and just, you know, try to be no different than if we were sitting at a table across from one another, you know, eating together. And asking more open-ended questions, you know, because the hard part is when he became hard of hearing and trying to communicate through the telephone. And he just would say, yes, no, he didn't hear one word that I had said or asked. He kept going and getting back x-rays and he needed a colonoscopy. Did you get your colonoscopy? Oh, yeah, I had to. You know, I should have known then. The VA ain't going to pay for no 2 colonoscopies. But learning to ask more open-ended questions like, well, what was it like getting that colonoscopy? Because, y'all, we know they're painful. So, like, that's not a great process. But keep sharing updates and highlights so that they know what's going on in your life and you know more about who's coming around. Who they're going out to dinner with, who's popping by to bring the friendly neighbor, bringing the mail in, the landscaper. I mean, you really need to know everyone that's coming around and being involved in your family's life. And then there's so many communication channels now that's even bigger than the traditional methods of just phone and email. There's so many apps and different digital platforms. And then you want to, what's really nice is maybe even involving them in some of our decision making and vice versa, just making for sure that you're staying actively involved and increasing that communication. So virtual visits. Does anyone ever use their FaceTime or anything or their computer to maybe do a tour of the house? Like if your loved one hasn't been able to come in and see your new home, or you haven't been able to be with them in a little bit, having them go around and just show you the house and what they did, or if they changed their comforters, because you can learn a lot whenever you're able to get visual contact about a home. Most of our referrals come in on holidays when family finally come down to visit. Whenever they come in and they kind of see, wow, mom really isn't doing that great. And usually the condition of the home will share that a lot. But the smart home devices, they are amazing because you can talk to people. We have some caregivers that live out of state. They have their Ring system set up they know more about our Meals on Wheels volunteers than we do. So like they're calling their agent resource specialist and they're like, look, Louis brought his dog with him today, or, like Louis went in and, thank you for going in and spending 15 minutes with mom. They really are using the technology to see who's coming and going through that Ring doorbell. And they'll even have cameras set up in the house. So online activities together. So when I first moved here, because I actually missed video poker, I would actually play online with some of my friends. I would play some of those video poker games online, but it's so easy to do now to be able to play something like that, or Sudoku, or crossword puzzles, or anything that your loved one enjoys doing, especially if they're down or if their mobility has declined and they're just pretty much doing a lot of chair activities. The family portals or blogs, like the email threads, those are great. And of course, the social media platforms. One thing about that with the scammers, I must have a type, because these scammers know what my husband looks like because of the pictures. And so all these new pictures of men that kind of look just like my husband, but has been actually working out, has started popping up on my friend request. And I'm like, I cannot believe they think I have a type. Like, I want to just like throw up random pictures to throw them off. And then my husband, he just thinks, he's like, that he nice looking if they think I look like that. But just as much as we are learning strategies to be better caregivers from long distance, so are people who are out there trying to take advantage of our loved ones. So personal emergency response systems, LodgeMark has really increased their products. We used to, back in the day, could only get the ones that were for landlines, and now they have the ones for cell phones. And they're pretty amazing because they can actually automatically detect your fall and go ahead and start calling in case someone was, to need help. And that's one thing about our home delivery meal program being more than a meal. We use a dashboard technology to monitor that. We have someone that watches it. And as soon as one of our volunteers check the box that someone's not at home, we immediately start calling their contacts. And then within 30 minutes, we have someone at their home trying to see if they need assistance. So definitely utilize resources out there for home delivered meals at any time you need to put an eye on someone. Let's see, wearable health devices. Like my whole family, they know when I don't sleep well. We have the family plan. They know if I don't walk as much. They know if I sat down and didn't take a break at work for more than 5 hours. These things tell a lot. So like that's even another app that can help you understand or know how much are we actually getting out and moving around. It's pretty neat that we can do that. GPS tracking devices, that's on your phone. Life 360, I'm a huge fan of that. When my dad first had dementia, that's what we put on his phone. It was pretty terrifying how fast he would go, and he was so cute, and he was the fire chief and the local pastor, so he could get away with anything. And then his hearing loss helped him with that. But one time I saw his truck not moving on 904 right before a snowstorm, and I was finishing my paper from school. So I sent my husband to go find him because, of course, he was so cute. The neurologist wouldn't take his license. We tried to take him to get his license taken away. And we thought he had fallen in the marsh because there was like marsh right there. And we were panicking. My husband called me and my sister, and we were really, she was freaking out. And then he pulled up with an officer, and he's like, "Why are y'all crying?" He had run out of gas and had just started walking down the road. But had it not been for that tracking device, I would not have even known that he was stranded and it was his friend, Mr. Marlowe. And he was like, something's wrong with your dad. I'm like, I know. Can you help me with this? Because I work for senior centers and this is my expertise, but I'm stuck. They will not take his license. But I swear by the GPS tracking devices. But see, since then, we've all kept it on our phone. So now my sister, my husband, my in-laws have now added the family circle. Now we're just nosy at this point, right? Like they're just like, oh, you home? Yes, I can't lie anymore. So I don't know how great that is, but that's where we're at today. The video calling, of course, y'all know how great that is. The smart lighting. I think I'm in the know, but I'm almost 50, but I have a friend, their whole life is managed by an app on their phone on their thermostats and their lights. And, oh, I forgot to turn on we're at church. Oh, I forgot to shut the garage. I'm like, what? Like, come set up my house, right? I just want you to come set up my house. But that is available and it's so inexpensive off of Amazon. So that is what we're trying to do at this time, because it can notify you the temperature. It will let you know if there's a fire, if the doors are unlocked, windows are unlocked. Like there's so much information that you can have access to. And of course, the adaptive home modifications with the automatic doors, the ramps, the stair lifts. There's so much. If you have a lot of money, you're set, right? If you don't have a lot of money, we're going to get to that part. But there's so much that's coming, and especially with technology and the AI that's coming our way. So with AI, one of the neatest things that I was noticing in my research that's coming out of a retirement community in Washington, D.C., they're using robots now they're doing a study using robots and AI to do a study on loneliness. And this AI is like an actual person. And I know they make a lot of movies about that, but it's very interesting. And I'm keeping track of it, of these robotic companions and what that looks like. So you can actually, in the future, what they're building, you can actually be a part of that robotic companion. You can move it around. You can go check on the person. I hope it's not like this kind of cat following you around the house, right? Where they think it might, pretended it's an animal, but it's really their child watching around the house. I'm hoping that it will get a little bit better. But it's going to be interesting over the next 5 years what kind of products are going to come out with AI. But in one of our conferences that we went to, the new virtual reality for therapeutic use, I thought that was pretty interesting. So it's almost like a video game, but you actually put on the goggles and you can actually, it's like you're on vacation. Like you feel like you're actually there. And then they can even use it for therapeutic purposes, where it could be like reminiscence therapy, like for people with dementia, they can actually, the same concept with music triggering memories. They do it the same with pictures or loved ones and go like videos from family events. But that's really interesting for that. And then the new, where's our DME guy? He left from Johnson. Okay, so I'm really keeping my eye out on the AI technology with durable medical equipment. So now they have these robotic exoskeletons. So the devices are wearable, but they assist you with walking and improving your gait. And then the algorithms adapt to your movement, but then it supports you better while you're actually walking to prevent falls. So I've got my eye on that to see what that's going to be like, because that's very interesting. And another one, because I tried to find whatever I could that was in my budget to share with y'all, but this is all you got because they're really expensive. But these smart glasses that are out now with the augmented reality. So if like let's say someone starts getting memory loss or forgetfulness, and let's say the neighbor, they're having trouble remembering how to get home. These glasses are programmed with a navigation assistance that could actually help them get home. It's almost like our Waze, but it actually would talk to them and help them maneuver to get home, and it's built into their glasses. So I thought that was pretty interesting with memory prompts. So that would definitely support us in the future with our daily task. And as you're watching online, don't have any questions, because I know I've been going pretty fast. Oh, good. All right, evaluating the need for new or changes in home, residential care, or community support services. This is a tough one, right? Like when are new services or more services needed in the home? And I know y'all had Candace Gray from AAA come not too long ago, and when we had that storm and I was unable to come the last time, I shared with her the presentation. So I hope this wasn't a duplication for you guys, because they are the experts with the Ombudsman program, and we all work close together. But I can just share some things from my own experience and things that we advise for folks to look for. But the main thing is, whenever you're assessing the care needs, what exactly does your loved one need? Because there's so many services now that can be provided in the home until it gets to a place, like I said, if you have all the money, there's no worries. It's when you have the limited budgets and you don't have access to what you need to live independently in the home safely, where it gets challenging. So knowing exactly what do we need, and then if you're looking at residential care facilities, consider the staffing levels. What's the staff to resident ratio? The cleanliness and safety and the quality of life programs. What are they actually doing, right? What are they doing to have fun? Because I know I want to play bingo. I mean, maybe that might be the main thing I'm looking for. Maybe some slots, but I have to move back to Nevada for that. Some community support services. You want to make sure there's accessibility. What are the available resources? And this goes into our programs. So like mostly for us, and most of your home community block grant programs are going to have your home delivered meals, your family care, your local senior centers. We go as far as helping with nutrition, boosts, disposable undergarments. Those things are so expensive. I could not imagine. I think right now, the last case that I bought, I think I averaged it out to be like $1.25 per each one. And that's a huge expense every time you're using the facilities. We have the mental health. We do a lot, and so much that I always have to look in our magazine. I'm like, wow, this is what we're doing. And you want to check reviews and references. Reviews say a lot, because we get pretty vocal on reviews. I mean, you will know the whole family history, like the neighbor, and what they got going on at the house when you're hearing stories, but that people put their reviews online. And you have the virtual tours, but you want to definitely tour the facilities as well. And review the licensings and accreditation. See if there's any restrictions. And AAA, our local AAA is really great with that. Our Ombudsman program locally here, they will definitely give you information if you're looking at homes or assisted livings or anything around here. And of course, the financial consideration. Even if someone needs Medicaid in our area, you pretty much have to have the cost up front for up to 3 months while you're waiting for a Medicaid bed, unless you've pretty much bypassed that route and maybe Adult Protective Services is helping with placement. but always planning ahead to know you need, I know we were talking about spin downs earlier, but if you think a home is in the future, making for sure that that's kind of put back at least 3 months while you're waiting on Medicaid. There's some assisted living or facilities that will allow for you to come on in and they just will trust that they qualify for Medicaid. I know when we did a tour of the most recent changes with Autumn Care, she said that they were doing that now. So that was good to know. But speak with the caregivers and staff if you can and see how they feel, if they love their job or they don't like their job. Because I think that says a lot about a company. If you meet an employee off the clock or, or hearing how they talk about their job. I was sharing with Jennifer whenever I was in the hospital, I really realized the value of aides. And that was the first thing that I wanted to do when I got back to work was advocate for a raise for the aides that are under our programs, because we also have the in-home aide program, because it looks different when you're the one receiving the care. And so we were able to do that with our hourly rate, and in our contracts we make for sure that we add what the minimum rate the aide would be paid, so that way we can ensure that our folks are being cared for, and assess the resident patient satisfaction. Observe the atmosphere and culture, review contract terms, and consider future care needs. Does the facility, does it transition into all stages? Is it something that you're going to have to plan for next move or transition? Those are all things to consider. And then the community service support services. When in doubt, you can always contact your AAA in that area of your loved one and reach out to someone like our team, like Andrew's team in New Hanover. They're always willing. I get those calls all the time, and I'm always willing to go do a drive-by or ride by or go check in. I have had other family members at time call and try to have us sneak in and do new wheels, power of attorneys, things like that. And our rule of thumb is if anybody's asking us to park on the side of the road and sneak into the house, like, yeah, that's not us. You're going to know I'm coming. So like that's something for me is a red flag that I report, because if they're going to ask us or try to talk us into doing something like that, they're going to do the same for someone else who might not know what's going on. And so, I mean, that's pretty much what I have. Are there any questions for me? Or questions like as far as being, I know we have a few caregivers here that have loved ones in other states, like any questions or areas that you're thinking more of where maybe you feel like you need more attention in, or what you're nervous about, or if you have any nervousness about. All right.
I know somebody handed me I'm not techie either, but they found it in the elevator where I work today. And I think it's a device that the family had for the resident to know where they're at, and what, how active they are and that kind of thing. So I think that's becoming, we have Alexas and all that stuff.
Like the AirTag.
Yes. I couldn't think of words, and somebody said it to me.
That is, yes. Because, there's some people who use that to track, or you're using that for like human trafficking too, but that is a great, because actually if you had an AirTag and someone was in a facility, you could kind of see them going down the hall.
And go, oh, there's mom. No.
Right? See, I would be that person. Slide it under, just let's see what this does. But yes, no, that's awesome. Yes. I mean, there's so much coming out right now It's definitely going to change the world of caregiving over the next 5 years. And I just hope that there's options and funding that can help subsidize or help support caregivers in that role, because I'm sure it's going to be pretty costly. Like there's lodger marks for fall prevention around $400. So we wrote a grant to try to cover those that are coming in through Adult Protective Services, because a lot of time our Adult Protective Services don't have the funds to help in those situations. So we're always looking for grant opportunities to support caregivers. Yes.
Is that a pendant or a risk?
Both. Yeah. Both. They have both options. Yes. So that was one of the reasons why, because Andrew turned us on to the first version, the earlier version of theirs that were landlines, because there's no monthly fee. It's just a one-time cost. And so that's actually for us, we consider that to be affordable, and grants get behind that, funders do, because it's not something they can't sustain. So now that they've come up with the cell phone version, with it being both options, it's a little bit more pricey, but it's worth it.
Well, that same systems are also doing the medication minder things. So
yes.
It sends an alarm and it tells you it's time to take your meds, and it opens the box at the appropriate time. So they can't take too many. It opens just the way that it's supposed to.
Yeah, yes, and there's a pharmacy in Tabor City. A pharmacist, he came and spoke to us, and he was showing us a new device that they have that blister packs work with, and they actually come and load it and set it up. But even the physicians can get on the app. Like it would notify the caregiver when the meds were not taken with these reminders. And you can even talk to your loved one. It's got a camera on it. You can talk to the loved one through this same machine that spits out the medicine in a blister pack. And the doctors can do their telehealth appointments through this same device, because some folks don't know how to use their technology well on their phones. But this one device that does the medicine, the telehealth appointments, it kind of can be your medical hub. And I thought that was pretty interesting. So we're trying to get grants for that now, because it's about, I want to say now it's about $1,700, $2,000, but it's worth it for someone who has a hard time with technology.
But if they take their meds, that's
yes.
Not taking meds and not eating. Two huge battles that would land them in the hospital every time. Yeah.
And you can watch them take their meds.
Well, they have the same thing for Fido. You do Fido a treat, right? Check on Fido and talk to Fido. So yeah, they're catching up with taking care of them dads.
Yes, I agree. And I guess now we can actually do our drawing. And if someone, I think all of them, we probably need to put all of them in here. Oh, yes. Okay. Yeah, and just put the half with your name. Oh, yeah, I could do the number. They're here. And of course, if you can't use it, maybe you could gift it to someone that can. Would you like to put your ticket in here?
I'm going to give it
to
the lady that just walked in.
So you didn't get to see the cat and the dog in action. That's supposed to help with loneliness and make you feel as if you have a pet. If you don't have a pet, you can even brush the pet. You want to do, so these are examples. This one actually has not been touched yet. So this is the one that we're giving away.
I was going to bring them to her.
Yes.